Good day, friends. Today, we are talking about lifestyle management. In fact, we are talking about health, wellness, and lifestyle management. And I am your faculty for today, and that is Professor Kennedy. If you were to look at the cause of disease over millennium, over centuries, you will find that 5 or 10,000 years ago in early history, the major cause of death was violence. This violence was caused by enemy tribes or perhaps wild animals. When we came closer to the 14th, 15th, 16th, 17th centuries, when man began to live together in a community and grow crops and build walls around the cities or his house and live in closer proximity with each other and with animals, a new spectrum of disease presented itself, infectious diseases. And today, in all the large cities, you have the poorer segments of society living together in what we commonly refer to as slums, where people live together in close proximity due to poverty. We have the same infectious diseases. But by and large, the world has moved on. And today, in the 19th, 20th, and 21st century, we have large pockets of prosperity. The world is a global marketplace. And this prosperity has led to a new type of disease. We refer to this as non-communicable lifestyle diseases. Now, if you were to consider the medical cost worldwide in terms of hospitalization or in terms of illness, then the major killers in the world are the heart attack, that accounts for 60% of the population, cancer, about 10%. Injury is the major killer of young individuals, on the one hand, and then on the other side, if you were to look at illness, OPD situations, individuals who are ill and at home, or individuals who are ill and are still working. You would look at hypertension and diabetes, which accounts for 25% of the population, individuals who have cardiac-related ailments, cancer, joint problems, stress, anxiety, depression, that is the psychological problems, digestive ailments, obesity, respiratory problems, asthma, bronchitis, pulmonary diseases. These are the major factors, the major cost factors in the world. The mortality, the individuals who die and the cost of that, and the illness, the cost of medication, the cost of absenteeism, the cost of presenteeism, the cost of low productivity. These are the factors that account for 80% of the cost. And if you correlate these factors or these ailments on the one hand and decipher the cause, you find that there are 3 or 4 common factors to all these ailments. The psychosomatic aspects correlate with stress, obesity and diet correlates with a sedentary lifestyle, and cardiac ailments, and smoking and alcohol correlate with cancer. An inappropriate lifestyle is then associated with 80% of Medicare costs. Inappropriate lifestyle, defined as a high-fat diet, a sedentary life, high levels of stress, and alcohol and smoking. These account for 80% of Medicare costs, and all of these are lifestyle diseases. So what is the definition of lifestyle medicine? The relationship and impact of day-to-day events on the illness and wellness of an individual and on the community. Simply put, lifestyle medicine or lifestyle management is the prevention and treatment of disease with lifestyle modification. Now, we had some basic statements, or we had some basic references of ailments and the cause. Now let's look at more precise quantification. I have been in the field of lifestyle management, lifestyle change for 40 years now. And way back in 1995, when we did our early surveys, we noticed that 67% of individuals suffered from several cardiac risk factors, and about 29% of this population correlated with cancer risk factors of smoking, etc. The lifestyle maladies or the lifestyle factors correlated were being physically unfit or not exercising at 55%, being overweight at 64%, having high levels of stress 41%, being on some form of medication 84% of a population. And this particular study covered about 500,000 individuals. Smoking 20%. Most of these individuals were born at risk due to family history. Their parents or grandparents suffered from cardiac ailments or cancer. So this was the scenario of India in 1995, which indicated that less than 15% of the Indian urban population living in the cities had an appropriate lifestyle and were healthy. Ten years later, or about 10 years later, in 2009, when we did one of our early child surveys, school health surveys relating to the health of children, we were amazed to find that children had poorer lifestyles or worse lifestyles, or were poor in health in several factors. They had high levels of stress in order, of course, to keep up with their studies and to try and match the needs of their parents. 52% were obese, sedentary, did not exercise. 52% of the teenage children had already experimented with smoking, alcohol, and drugs. And 60% of children, especially the teenagers, had already suffered some form of injury due to automobile accident or certain other recreational activities. At the same time, the World Health Organization also discovered and announced that the health of children was worse than the health of adults. In the year 2000, I had been traveling to several countries, a few of which are represented here. You have the Middle East with the Kingdom of Saudi Arabia, and you have the United States where I did my studies, and you have Australia where much of my family lives. And you have a look at these statistics. 4 levels of activity: overweight, stress, chronic ailments, diabetes, cardiac ailments, smoking, alcohol. The richer the country, the higher seemed to be the risk, the higher seemed to be the medical need, the worse seemed to be the lifestyle. In those years, we could not evaluate the stress levels in the Middle East. It was not allowed. And at the same time, alcohol was against the religion, and therefore it was inappropriate for us to measure these factors. Nevertheless, there's ample indication that there were high levels of stress in these countries also. Whichever way you put it, 50% of the human population now seem to be living inappropriate lifestyles. And the WHO, moving into the area of lifestyle management, came to its own realizations. In 2005, it declared that the major risk factors for lifestyle disease are an unhealthy diet, physical inactivity, and tobacco use. It said that men and women were affected almost equally, and it emphasized that children were more at risk than adults. Why do we need to pay attention to health? From a governmental perspective, from an individual perspective, it is important for each of us to remain healthy, but how does that impact the government? It costs money. Individuals who are not healthy are less productive. Individuals who are not healthy have more medication and hospitalization. And if we were to look at some of the budgets of some of the world's larger economies, or some of the economies that were relevant to me in my various studies, the Americans spent $6 billion a day to keep their population healthy. $2 trillion per annum. The Indian medical budget was 100,000 crores. The UAE medical budget at 100 billion a day was 50 billion dirhams per year. And the Saudi budget, as you can see, was 160 billion riyals. Astronomic amounts of money, and almost 20% of the total budget was being allocated to keeping individuals healthy. And this was not the final cost. This was only 20% of the actual cost. The major cost came in lost productivity. Individuals who are healthy are less productive, and therefore lower productivity accounted for more than 75% of the total expenditure and loss of production on account of poor health. If you were to look at a corporate or a country, if an individual has disease, he will be absent from work. He will have higher levels of morbidity, lower levels of productivity, higher levels of cost, resulting in higher expenditure and lower revenue. This is relevant to a corporate organization. This is also relevant to the larger country. If you were to look at lifestyle management from a global perspective, and you look at the advanced economies, and you try and understand the cause of injury, the cause of disease or illness or injury, then you find that the leading cause is heart disease, followed by depression, followed by stroke. And if you look at the causative factors, the major causative factors for illness: tobacco, blood pressure, alcohol, obesity, physical inactivity. All of these manageable by lifestyle change. And you will imagine that poorer countries would fare better, but they fare no better. If you look at the cause of, if you look at the disease or the ailments, depression leads from the front, then you have stroke, then you have respiratory illness, respiratory ailments, injury, ischemic heart disease, almost a similar trend to the developed world. And the causes: alcohol replaces smoking, chewing of tobacco replaces smoking of tobacco, blood pressure, obesity has a double-pronged system: obesity and also underweight due to malnutrition, and so on and so forth. Again, all the factors that come under risk can be changed by appropriate lifestyle. And therefore, again, if you go back to the WHO declaration of chronic disease, it says lifestyle was responsible for 80% of deaths worldwide, half of which occurred for productive individuals under the age of 60. And it was equally relevant whether in a developed economy or in a developing economy. So what are the solutions? If lifestyle is the cause of 80% of Medicare costs worldwide, what is the remedy? One, to have a lifestyle check annually, along with a medical check. Identify cause as much as you identify illness. Improve nutrition. Manage and improve exercise. Manage stress and sleep. Avoid smoking and alcohol. Adhere to the rules of safety. These have been propounded by the World Health Organization, the Center for Disease Control, and other leading agencies, the American Council of Lifestyle Medicine, the European Lifestyle Medicine Organization, have all identified personal solutions as a health and wellness check, appropriate nutrition, sufficient exercise, sufficient sleep and relaxation, avoid smoking and alcohol, and safety at all times. If that was the solution for the individual, then what is the solution for a community? One, to have as many lifestyle professionals in the form of psychologists, nutritionists, and exercise professionals as you have medical doctors and nurses. Balance your illness professionals with your wellness professionals. Add the health check to the illness check. Check to see how healthy people are as opposed to how unhealthy they are. Empower individuals to manage their own health. Teach them. The doctor need not be the manager. The individual should manage their own health through education. And build as many gyms and fitness centers and yoga facilities as you are building hospital clinics or illness facilities. These were some of the suggestions to move away from augmentation of medical clinics and introduce preventive and promotive healthcare facilities to improve lifestyle. And from this, over the year 2000, the wellness industry was born from the 1950s onwards. And it infiltrated into all the different segments and delivered its own product and services. We now have wellness facilities or wellness departments within hospitals. Pharmacies have their own range of medications, vitamins, pills, supplements, minerals to improve the nutritional content. You have spas and yogas and gym facilities to rejuvenate and make the population healthy and manage weight. You have academic institutions that make available certificate programs in corporate health, lifestyle medicine, nutrition and weight loss, exercise and fitness, psychology and stress management. All of these are part of the wellness segment. And then most importantly, you have health insurance. Insurance that has a segment to improve health. And all this has come as a $500 billion industry. Without a doubt, the United States led the field in terms of sheer size and change. They incorporated health clinics, lifestyle clinics, the American Council of Lifestyle Medicine, and so on and so forth. And they proved that healthy individuals reduced cost, reduced Medicare cost, and improved productivity. They proved that health was an investment and not an expenditure. They proved that health improvement gave you a return on investment of 4 or 5 times. Wow, Singapore. Working on Wellness Singapore. They had this health promotion board as part of the Ministry of Health. And in that ministry, they promoted corporate health and school health. and they made available their unique programs, health screening, health education, age-related sports programs, free vegetable and fruits in all canteens. And they awarded, rewarded, and recognized individual employees who maintained good health. Australia proved that with their various systems, healthy lifestyle choices, healthy school program, supporting seniors, promoting walking and cycling, managing obesity through physical activity, they proved that the population could improve by 20% in fitness, reducing of obesity by 1%, reducing cardiac risk by 3%, reducing smoking by 13%. And these are random countries that I've selected. The whole of Europe has its own programs. The whole of the Middle East has its own programs. So, ladies and gentlemen, friends, what is lifestyle management? Lifestyle management is the management of our day-to-day activities that improve our health and the avoiding of those things that make us unhealthy. We need to manage our diet so that we have the right food in the right quantities. We need to exercise. We need to sleep sufficiently. We need to cut down on smoking, manage our weight, and prevent injury. And by doing this, not only will we as individuals be healthy, but we as a population and as a country can remain health-free through lifestyle management. Thank you.